Hi, welcome back. Today, let's talk about migraine. Migraine is not just a normal headache, it's a medical condition where a person gets repeated attacks of head pain along with other symptoms. In medicine, it is called a primary headache disorder, meaning it comes from how the brain and nervous system work, not far from other disease. When a migraine starts, the pain is usually moderate to strong and often throbbing, but it can also feel like pressure or a dull ache. Many people feel it on one side of the head, but it can also be on both sides or move around. It is not only pain. People often feel sick in the stomach and some vomit. Light and sound can feel very uncomfortable. Even normal light like sunlight or a phone screen can feel too bright. Some people notice warning signs before the headache starts. This is called an aura. It can look like flashing lights, zigzag lines, blurry vision, or tingling in the face or hands. It does not happen to everyone. It happens about 1 out of 4 people with migraine. When it does happen, it usually comes before the headache, but sometimes it can happen during it. There is no single cause of migraine. It happens because the brain and nerves become more sensitive than normal. Pain systems in the brain become overreactive, especially a system called the trigeminal system. During an attack, the brain reacts more strongly to pain signals. Chemicals in the brain like serotonin and CGRP are also involved, but there is no one single cause. It is better to think of migraine as a brain sensitivity problem that leads to attacks. Many things in daily life can be linked to migraine attacks. Stress is a common one. Changes in sleep like sleeping too little or too much can also play a role. Skipping meals or not drinking enough water can trigger attacks. Some people are sensitive to certain foods or drinks like alcohol or caffeine changes, but this is different for each person and sometimes it's part of early migraine signs, not the real cause. Bright light, strong smells, loud noise, and weather changes can also trigger attacks in some people. Hormone changes in women like during periods, pregnancy, or menopause are also common triggers. These are better seen as things that make the brain more likely to start an attack, not direct causes. Some people are more likely to get migraines. It often runs in families, so genes play a role. It is more common in women than men. It often starts in teenage years or early adulthood. Stress, anxiety, and depression can also make migraines more likely or more frequent. To prevent migraines, it helps to keep a regular daily routine. Sleep at the same time every day. Eat regular meals, drink enough water, and manage stress. Some people also learn their personal triggers by tracking when attacks happen. If migraines happen often, doctors may give preventive medicines such as beta blockers, certain nerve medicines, or CGRP targeting medicines to reduce how often attacks happen. When a migraine happens, the goal is to reduce pain and rest the body. It helps to lie in a dark, quiet room. Cold packs on the head or neck can help. There are also specific migraine medicines like triptans and newer CGRP medicines that can stop or reduce an attack. Rest and fluids are important because the body becomes more sensitive during an attack. Migraine can be very disturbing, but it is a real medical condition and it can be treated. When people understand their body and what can trigger attacks, they can reduce how often migraines happen and manage them better. Thanks for watching.